Hey, everybody, friends, Santa Feans, everybody watching, thank you for joining us. I'm Alan Weber speaking to you Wednesday from the mayor's office. And I'm joined today by Dr. David Arredondo, who is the Chief Medical Officer at Presbyterian Healthcare Services. Thanks for being with us, Dr. Arredondo. Uh, I'm going to ask you a bunch of questions about vaccinations and COVID and get some really good medical advice. Before we do that, I want to point out that our numbers in Santa Fe County have been moving around a little bit. We had a really good day of only 9 new cases, and then yesterday we went back up to 28 new cases. So we are not out of the woods by any stretch of the imagination. We've got to continue to wear masks like Dr. Arredondo and I were just doing, use hand sanitizer, practice physical distancing, stay safe. Hopefully all of us were safe over Super Bowl Sunday and we didn't do a super spreader event. And now, as the weather gets better, we can maybe get outside, stay physically distant. We want to go from red to yellow to green, and then beyond green, try to get opened up as we hit the spring and the summer. Um, so with me, as I said, is Dr. Arredondo. We are very grateful that he's here. We're trying to have regular visits from our medical professionals and our public health experts here in Santa Fe, because there are a lot of questions that folks are concerned about or interested in. How are we doing with COVID overall? What are we doing with vaccinations? How about more testing? Should we stop testing, or will testing be useful now that we have free testing from Vault Health? So, Dr. Arredondo, let me just ask you an essay question. From where you sit at Presbyterian, how's Santa Fe County doing? Where are we taking on COVID and bending the curve? Where do we need to continue to stay vigilant and do a better job?
Well, the curve is definitely bending. I mean, I watch as we all do, I watch the statistics every day. The number of patients that test positive in a 24-hour period has been going down since October. And we are now at numbers that are much more manageable. Here's a critical number. The number of patients in the hospital statewide has gone down by almost half over the last couple of months. That's a huge number. The number of deaths have gone down. So those are all great numbers. The curve is definitely bending already, and it's bending in a significant way. So now the question becomes is what policies and what things should we be doing for the next several months? We cannot become complacent.
Yeah, absolutely. I think we are not, there's an interesting series of, ways to think about it. There's a light at the end of the tunnel, hopefully, with vaccinations. We are seeing variants arrive, which are worrisome because they do apparently spread more rapidly and easily. And at the same time, we can't get complacent. So the good old fashioned advice still works. Wear a mask, practice physical distancing, use hand sanitizer, and more testing can play a role in getting us from red to yellow to green. If people test negative, we get a better result overall. Our ratio looks better. We may get out of red into yellow and have more openings of ability to get together, go into a restaurant for a meal, or in other ways feel more open without becoming complacent. So back to the basics, I guess, is part of the message.
Yeah, we should not be overly we should not be thinking too much about the day that we can not wear a mask, the day that we don't have to distance, the day that we don't have to be careful about keeping our hands clean. We shouldn't be thinking that way. I think right now we say to ourselves, we have to continue all of these safety precautions until such time as this virus is truly under control, because we are not there yet.
Yeah. So let's talk about the vaccination picture as you see it. You're on the front line. Presbyterian is part of the answer to getting medicine into people's arms. And yet we are dependent upon the federal government and suppliers to get the doses into your hands and the hands of others. How do you see the supply of vaccine uh, at this point? Is it more regular? Is it more predictable? Or are we still wondering every Monday what's underneath the vaccination Christmas tree?
Well, we are still, unfortunately, we are still experiencing some fluctuating supply. So even in the last week or so, we saw a significant reduction in that in our allocation, just in the last week or so. Now, because things have been changing so quickly, we may just as immediately see a big influx of vaccines and then find ourselves right where we would like to be in terms of being able to give out vaccines. But I know that just in the last week, I was in a meeting this morning where our allocation was 30% of what we had anticipated, which then creates problems because then patients who are now scheduled for their repeat vaccine, it's time for their second vaccine, and we want that to happen within a matter of weeks. Then we have to scramble, and maybe patients who were scheduled for first vaccine have to wait a little longer because now we need those vaccines to give as boosters to people who have been previously vaccinated once. This changes on a daily basis, and we are literally meeting daily on managing this fluctuating supply of vaccines. And we're also seeing the Moderna vaccine is now arrived, and we're managing the availability of either vaccine because we can't in a given patient. If your first vaccine is a Pfizer vaccine, the second one needs to be a Pfizer vaccine, and the same with Moderna. So we've got to be careful about that as well.
What are the prospects for Johnson and Johnson vaccine showing up? That's a one dose vaccine, as I understand it.
Yeah, it does sound promising. I mean, everybody likes the idea of just having one vaccine. It's going to be able to. It's got all kinds of advantages, and but I have not heard any specifics about when it's going to arrive here. So I don't think I know any more than anybody else about when that might happen.
Okay. How about registering for my vaccination with the DOH? That's still a good thing to do.
Absolutely. I mean, that has made it really. I think that makes it really easy for people. You get on the website, you enter some information, your name and whatever else they might ask, and then you just sit back and you wait. And the DOH will contact you and say, "Okay, here you go. Here's your appointment."
Now, what if I don't hear from the DOH? Is there a, should I call the hotline or just be patient? Do I call Presbyterian and find out why I'm not getting a phone call? What people are understandably anxious. They want that medicine, and particularly older folks who are more worried. They may have underlying conditions they're concerned about. As I get frustrated or anxious, what can I do to get more information or feel like I haven't been skipped over or lost?
Yeah. Well, I can certainly understand people that might feel that way. You're kind of waiting and waiting, and then you're wondering, have you been skipped? Has your name dropped off? Would it make sense for you to get back on the website and double check? I think there's two sides to that. Number one is if everybody starts doing that, I think I would worry that we would start overwhelming the capacity of the DOH to manage the people that are there. And so it may not be helpful. So my own personal opinion is if I were to put my name in today, if I hadn't heard anything in several weeks, I would like maybe to check back. Now maybe as this process evolves, and it is an evolving process. I mean, you think about this. None of us have ever done this before. We've never lived through a mass vaccination. I mean, the last mass vaccination that I experienced as a small child was the polio vaccine in the 50s. So we haven't done this before. So it's new. And I would have to assume and expect that as the DOH is building this process, that I would assume that they would build in some over time, if they haven't yet, build in some kind of a mechanism where people can just double check, am I still in the queue? Do I need to worry or not?
It's great. And you mentioned regular meetings. I don't go to those. I'm not a doctor, but I'm told there's a lot of coordination going on among all of our healthcare providers so that it's not they're not siloed. Everybody's talking to everybody to try to make sure that the process is transparent, it's as predictable as possible, it smooths out over time, and people can expect things to get faster, better, and more people getting their shots in their arms.
It is getting better. I mean, I remember in the very beginning, it was very rudimentary. We just said, okay, we're going to give vaccines over at the ambulance office, and people just showed up, but it's gotten much more sophisticated. We are now, it's much better coordinated. We have multiple sites within the Presbyterian system that are all talking to each other. We are maintaining careful communication about vaccine supply. So the issue now is not our ability to physically deliver the vaccine. It's much more related to the availability of the vaccine. So we have the ability to ramp up our delivery capacity as long as we have the vaccine to deliver. So that's really kind of where the bottleneck lies right now.
Yeah, I think I've said this before. I think President Biden opened up the medicine cabinet when he came into office and was surprised it was kind of empty.
That's right.
So now the medicine cabinet is hopefully getting filled up. They're not only talking about getting more vaccine production, but also more syringes, and then more information, better information, better apps, and making it more transparent so folks are less anxious about being skipped or left out, or is the system fair? I mean, I think that's the other thing you hear a lot is it's not fair. I'm more needy than, or I'm more at risk than somebody who appears to be less at risk. Of course, you never know what the underlying conditions are or whether the person who is getting vaccinated is an essential frontline worker.
Well, you can imagine the challenges in trying to draw sharp lines between this category of people and this category of people, either by age or demographics, or they have diabetes. Do they have severe diabetes? Do they have mild diabetes? I mean, it's just a spectrum. And so it's truly remarkable that we've been able to even categorize at all. So it has made sense just to create very broad categories, because trying to get any more sophisticated than that is really not going to help.
Right.
So it's a good process.
Let me ask you a hot button question.
Sure.
We have folks who are jumping in their cars and driving to Texas or Colorado. This vaccination tourism, or drive to your nearest dispensary in another state. People are going to do that, but from your point of view, does that make sense? Does it help the process?
I think there's two ways to look at it. Number one is for the individual that says to themselves, I really want a vaccine. I really need a vaccine. And people are going to take it upon themselves to kind of circumvent certain things and cross borders and find different ways to get a vaccine. I can understand that impulse. On the other hand, if we think about it, if too many people start doing that, it will start to confound the system, and it really won't help. It may not ultimately lead to more people overall being vaccinated. So I'm not sure that I would encourage that. I think people need to follow the policies within their community, whether it's their city or their state or their county. I would encourage people to follow the processes within their communities.
Yeah, and I think your point about look how far we've come in a very short period of time. And I do remember how, early on it felt like there wasn't enough information or clarity, or even the dashboard didn't really stand up to questions, nor did the registration site. I think it's getting clearer, better. Hopefully, at the end of the day, we'll just get more supply. The more supply there is, I think all of our hospitals and DOH themselves have the ability to just get more medicine into people's arms.
I mean, our timeline is so compressed. So think back to less than a year ago when we didn't even have enough masks, we didn't have enough gloves, we didn't have enough PPE. I mean, that was really scary. We got beyond all that, which was really remarkable in just a matter of months. It was only a few months ago that we did not know if we were going to have a vaccine in January. I mean, people were predicting, the vaccine is going to take 18 months. We heard that over and over. And amazingly, the vaccine was ready in much less time than that. The studies have been completed. Tens of thousands of patients have been studied, and we've got the vaccine now. So now it's just a question of cranking them out so that people can get them.
Are you, one last question, doctor, and I'll let you get back to doctoring. I'm always interested in what folks are saying about the impact of the first shot and the second shot. I've heard sometimes there's a little pain in your arm or a little at the site of the injection, there's a little swelling for the first shot. Second shot, some people have actually, stayed in bed for a day to try to deal with what feels like flu-like symptoms. As we look forward to more and more people getting vaccinated, it's fair to advise people what to expect when they are vaccinated, so it's not a shock or a surprise if there is soreness or a flu-like after effect. What are you seeing at Presbyterian?
I'm seeing remarkably few serious reactions. And a serious reaction can be defined even as you feel really bad for a day, and then the next day you're fine. So the vast majority of people have had no symptoms whatsoever. I had both vaccines, and I experienced zero symptoms. My arm didn't even get sore. So it's very idiosyncratic. I'm not sure there's any way to correlate a person's risk of a reaction to anything else that's going on with them, either their age or anything else. So I think the way we have to say this to ourselves is, yes, there's a very small chance you might have some kind of a reaction, but you weigh that risk against the risk of getting COVID and ending up in the hospital on a ventilator and potentially dying. I mean, it's just a no-brainer, I think.
Great. Any Dr. Arredondo, any last words while you're offering advice, counsel, medical wisdom to folks in Santa Fe? What are you? How do you leave it with folks speaking from Presbyterian?
Well, this is the kind of conversations we've been having lately in Presbyterian. So what's going on now isn't just about the vaccine. It's about this entire pandemic and all of the effects that it's having on our psyche, on our businesses, on our kids being able to go to school and people having their jobs. It's touching our lives in so many ways. The vaccine is a part of it. So what we've been encouraging people to do is to be supportive of each other, to be patient, and not to get angry, and not to apply blame, because we're all working toward the same goal, and ultimately we're going to beat this virus and we'll be back to a good place.
Thank you. That's great. It is something that goes beyond just the physical health. There's mental health, there's emotional well-being, there's social well-being, and
Absolutely.
certainly Santa Fe is a place where people practice great compassion and community love. So you should never stray from that too far.
Right.
Thank you. Dr. David Arredondo, the Chief Medical Officer, Presbyterian Healthcare Services. Thanks for being a guest. I really appreciate it. I think it's very reassuring to folks that we have the caliber of individuals looking after us, like yourself and the other folks at Presbyterian, and I'm really appreciative of time and your knowledge and expertise. So thank you. We'll have you back again.
Okay. Thank you, Mayor Weber. Thank you,
Thank
Joe.
you. Appreciate you. Well, that is really good to hear, everybody. I think it's useful for all of us to get that kind of advice from medical expert like Dr. Arredondo. And I want to mention a few more things on the COVID topic before I pivot to a few other issues. Number one, there is a dashboard, a vaccine dashboard. You can check it to see how we're doing in Santa Fe County. Currently, I think we rank number 6th in the state in terms of counties as we look at our level of vaccine application. 26%, almost 27% of Santa Fe County residents have been vaccinated. If you go to cvvaccine.nmhealth.org/public-dashboard.html, way too long. Just Google vaccine dashboard, Department of Health. It'll come up. Secondly, we do have resources for people who need help because of COVID. The Connect program that the city and county are collaborating on is making resources available. If you need help, go to the santafenm.gov website and look for Connect. Connect has the ability to get you connected to a navigator who can deal with, respond to, assist with your specific needs. More testing is better. We continue to need good tests to drive our future from red to yellow to green. You can get a free test at home. It's not a swab that goes into your brain. It is a vial, a tube that you spit into and send in and get a free evaluation. You can go to learn.vaulthealth.com/nm. Vault Health is the provider. It's free. It takes about 5 minutes to fill out a questionnaire, and they send you a kit. Probably takes 3 or 4 days to get your kit. You have to make an appointment to have an observer while you take the test. You put it back in the package, you mail it in. A couple days later, free results. Remember also, we are focusing on the Novid app, Novid. It's an app for your smartphone to indicate whether you are in the presence of someone who may have tested positive. It's like a early warning system for the presence of somebody who may be positive. So we are still trying our best to bend the curve. As the doctor said, we have made progress, but we want to get back down into single digits in terms of cases that are in our community. Do the basics, wear a mask, practice physical distancing, wash your hands, get registered to get vaccinated at the Department of Health, and let's try to make our county move from red to yellow to green, and then beyond green, we can really open up and have much more activity, community engagement, increase the size of gatherings, maybe have indoor dining, increase retail capacity. In the meantime, please remember to shop local. SantaFeMarketplace.com allows all of us to buy local goods from our local merchants on the web. It's been stood up by our tourism department. We're really grateful for that. SantaFeMarketplace.com. Remember, keep your money where your home is, right here in Santa Fe. Some good reports on tourism. 3 of our hotels have been rated best in the USA. The Inn of the Five Graces, the Rosewood Inn of the Anasazi, and the Four Seasons Resort, Rancho Encantado, all rated in the top hotels in America. That is not a small honor. That's a big deal. And it particularly will pay dividends as we look to the spring, summer, and the fall reopening, getting our tourist economy back on track. I've written a letter to the governor and the heads of the legislature encouraging a $25 million allocation to the state tourism department to help promote a return to tourism here in Santa Fe, to get our hotels, our restaurants, our mom and pop retailers back in business, bring back guests, make sure it's safe, make sure we've got the vaccination process moving smoothly. We need to think about an economic recovery as well as a public health recovery. Some fun, those of you who are murder mystery fans, 5 readers from New Mexico will each read brief passages from Peggy Van Holstein's new book, The Art of Murder. The Art of Murder. Our librarians are at their best with an online author event, a Zoom call. This murder is, the storyline is set in Santa Fe with scenes in Los Alamos and northern New Mexico, according to what I'm told. You may recognize some of the quirky characters in the book because they're based on real people right here at home. Santa Fe Public Library author event. It's Thursday, February 11th, 5 p.m. It's The Art of Murder. You can find it. I'm sure if you go to the city's website, you'll be able to find it. Another great event coming up is we all do this. It is the Love Your River Day. Friday through Sunday, February 12th through the 14th. It is help clean up the Santa Fe River and the arroyos. You can pick up trash bags at Frenchie's Field Barn each of those mornings, Friday through Sunday. Bring your own bags and gloves. Wear a mask. It's the 15th annual Love Your River Day. And it is courtesy of the Santa Fe Watershed Association. Let's really show some love to our river and our arroyos. Coming up today is a meeting of the governing body. Lots of interesting presentations. I hope you will tune in. Not so many public hearings, but public presentations about issues of great interest to all of us. There'll be a presentation on water and water policy. There'll be a presentation from our Midtown team of city managers and consultants to talk about how to evaluate where we go from here with Midtown. What are the pluses and minuses? How do we build value at the site so that it continues to be a desirable place for housing, higher education, film and digital media, an economic place where we can diversify our economy as we reopen. So that is this afternoon. Again, you can access it through the city's website. A lot going on, but the number one story continues to be, how do we bend the curve of COVID-19? How do we reduce the spread? How do we get more testing? What do we do about vaccinations? One other good word, Thursday, February 11th, 7 to 9 a.m., Food Depot, food distribution, 122 Siler Road. Our friends at the Food Depot continue to do great work to make sure people in Santa Fe have food. Nobody should be hungry in our community. If you need food, Siler Road is the place to get it. If you are able to contribute, make a contribution to the Food Depot, make sure that they have the resources they need to help all of us take care of all of us. That's it for today, friends. Thank you for watching and listening. I will see you tonight at the governing body meeting. And then again on Friday, we'll take up more information on COVID, on vaccinations, on how the process is moving. For those of you who are asking about the city, as I said in the newspaper this morning, we've told the DOH, the Department of Health, tell us what you need. We will do our best to be your best partner. We want this rollout to continue to be smooth, transparent, absolutely fair and equitable. We want to make sure that everyone gets treated in a way where we are safe, open, and together. So till I see you next time, thanks for watching and listening. Please remember to take care of yourself, take care of your family, take care of your neighborhood, your community. Together, we will all take care of Santa Fe. We're going to make it through this together. We're going to come through it together. We're going to begin the recovery together. Thanks, everybody. Stay well. See you next time.